Hello everyone, in this video we are demonstrating the clinical examination of masticatory muscles. The muscles include masseter, temporalis, lateral pterygoid and medial pterygoid. The masticatory muscles attach to the mandible and thus produce movements of the lower jaw at the temporomandibular joint to enable functions such as chewing and grinding. These movements include protrusion, which moves the mandible forwards, retraction, which pulls the mandible backwards, elevation, which elevates the mandible and closes the mouth, depression, which depresses the mandible and opens the mouth, rotation, which produces side-to-side movement of the mandible. Temporalis muscle, it's a large fan-shaped muscle that originates from the temporal fossa and lateral surface of the skull. Its fibers come downwards to the zygomatic arch and lateral surface of the skull to form a tendon that inserts into the coronoid process and the anterior border of the ascending ramus. It can be divided into three distinct areas. Anterior portion consists of fibers that are directed vertically. Middle portion contains fibers that run obliquely around the lateral aspect of the skull. Posterior portion that are aligned almost horizontally. Temporalis muscle can be seen and readily palpated throughout the entire length and breadth when the patient's teeth are clenched firmly. Readily palpated throughout the entire length and breadth when the patient's teeth are clenched firmly. Origin is superficial portion, anterior 2/3 of the lower border of the zygomatic arch. Deep portion is medial surface of the zygomatic arch. Insertion, lateral surface of the ramus, coronoid and the angle of the mandible. Palpate multiple areas of the masseter muscle. As with the temporalis, it can be located when the patient's jaw are forcibly closed. The body of the masseter can be palpated with the thumb and the index finger. Index can palpate the entire body of the ramus. Medial pterygoid origin, medial surface of the lateral pterygoid plate and the tuberosity of the maxilla cannot be palpated. Insertion, lower medial surface of the ramus of the mandible. Anterior portion of the insertion can be palpated by placing the finger at 45 degrees to the floor if the patient's mouth nearly close to the relaxed tongue. The opposite hand can be used extraorally to palpate the posterior and inferior portion of the insertion. The body of the muzzle can be palpated rotating the index finger towards upward, the muzzle near to its origin on the tuberosity. Lateral pterygoid origin, it originates in two parts: superior head from the greater wing of sphenoid, inferior head from the lateral surface of the pterygoid plate. Insertion, neck of the condyle and articular disc of TMD. Palpation of lateral pterygoid muscle. The muscle is palpated by using the index and the little finger and placing it laterally to the maxillary tuberosity and medial to the coronoid process. The finger presses upwards and inwards and a painful response can be determined.